Question 1. A radiologist reviews and interprets a chest CT with contrast that was performed at an outpatient hospital facility. The radiologist is not an employee of the hospital and performs the interpretation from a separate location. Which modifier should the radiologist append to the CPT code? A. TC, technical component. B. -52, reduced services. C. -26, professional component. D. No modifier is needed. Answer: C. -26, professional component. This question tests the concept of splitting a radiology service into its professional and technical parts. The keywords reviews and interprets indicate the physician's cognitive work, which is the professional component. Because the hospital provided the equipment and staff, the technical component, the independent radiologist must append modifier -26 to the CPT code to bill only for the interpretation service. For example, the radiologist would bill $71,260 to 26, while the hospital would bill $71260 TC. Remember to use modifier -26 whenever the physician provides only the interpretation for a test performed elsewhere. Question 2. A patient with right upper quadrant pain undergoes a complete abdominal ultrasound. The sonographer documents visualization of the liver, gallbladder, common bile duct, pancreas, spleen, kidneys, and the upper abdominal aorta and inferior vena cava. Which CPT code should be reported? A. 76705, ultrasound, abdominal, limited. B. 76770, ultrasound, retroperitoneal, complete. C. 76700, ultrasound, abdominal, complete. D. 76775, ultrasound, retroperitoneal, limited. Answer: C. 76700, ultrasound, abdominal, complete. This question assesses the criteria for a complete versus a limited ultrasound. The CPT definition for a complete abdominal ultrasound, 76700, requires the visualization and documentation of a specific list of organs, including the liver, gallbladder, kidneys, pancreas, spleen, and major blood vessels. Since the documentation explicitly mentions all the required elements, the correct code is for a complete study. If any of these organs were not imaged, a limited study code, 76705, would have been more appropriate. Question 3. A patient undergoes an MRI of the brain first without contrast, and then the study is repeated after 4 contrast administration during the same session. How should this be coded? A. Report one code for MRI brain without contrast, and a second code for MRI brain with contrast. B. Report a single CPT code that describes MRI brain without contrast, followed by with contrast. C. Report the code for MRI brain with contrast and add modifier -22 for the extra work. D. Report only the code for MRI brain with contrast as it is more comprehensive. Answer: B. Report a single CPT code that describes MRI brain without contrast, followed by with contrast. This tests the correct coding for studies performed with and without contrast in the same session. The CPT manual provides specific combination codes for procedures performed sequentially without and then with contrast. The keyword clue is first without, then repeated after, contrast, signaling a 2-part study. It is incorrect to bill separately for the without and with portions. You must use the single, more comprehensive code, e.g., 70553 for brain. Always look for a single code that captures the entire service before trying to report multiple codes. Question 4. A 45-year-old asymptomatic woman with no family history of breast cancer presents for her annual mammogram. Computer-aided detection, CAD, is used to analyze the images. How should this be reported? A. one code for a diagnostic mammogram. B. One code for a screening mammogram and a separate add-on code for CAD. C. One code for a screening mammogram that includes CAD. D. One code for a unilateral mammogram with modifier -50. Answer. B. One code for a screening mammogram and a separate add-on code for CAD. The concept tested is the proper use of add-on codes for supplementary services like computer-aided detection, CAD. The keyword asymptomatic indicates this is a screening mammogram, not a diagnostic one. The use of CAD is not bundled into the primary mammography code and must be reported separately with its specific add-on code, plus 77067, to account for the additional technology used. Remember, add-on codes, marked with a plus symbol, can never be reported alone and must accompany their designated primary procedure code. Question 5. A freestanding imaging center owns the CT scanner and employs the technologist. A patient has a CT of the abdomen with contrast performed at the center, but the images are sent to an off-site teleradiology group for interpretation. What modifier would the imaging center use on its claim? A. -26, professional component. B. TC, technical component. C. -59, distinct procedural service. D. No modifier is needed. Answer. B. TC, technical component. This question is about identifying the technical component of a radiology service. The keywords owns the CT scanner and employs the technologist mean the imaging center is providing the equipment, supplies, and staff, which constitutes the technical portion of the procedure. Since the center is not providing the physician's interpretation, it must append modifier TC to the CPT code, e.g., 74160TC. This modifier ensures the facility is only paid for its part of the service, while the radiologist who reads the scan will bill separately with a -26 modifier. Question 6. A patient undergoes a postanterior, PA, and lateral chest X-ray. How many views were performed? A. 1 view. B. 2 views. C. 3 views. D. 4 views. Answer. B. 2 views. This question tests basic knowledge of radiologic terminology for projections, or views. Postanterior, PA, describes one view where the X-ray beam passes from back to front, and lateral describes a second view from the side. Therefore, a PA and lateral study consists of 2 distinct views. Correctly counting the views is essential for selecting the right CPT code, as codes like 71045, 1 view, and 71046, 2 views, are differentiated by this detail. Question 7. A physician performs a fine needle aspiration of a deep lymph node, using CT guidance to accurately place the needle. How should the imaging guidance be reported? A. It is included in the code for the fine needle aspiration. B. With a separate CPT code for CT guidance. C. With modifier -51 appended to the fine needle aspiration code. D. It is not billable, as it is considered part of the physician's standard technique. Answer. B. With a separate CPT code for CT guidance. This question tests the coding principle for radiological guidance used during a non-radiological procedure. When imaging like CT, ultrasound, or fluoroscopy is used to guide a procedure such as a biopsy or aspiration, it is considered a separate, reportable service. The work of performing the CT guidance is not bundled into the fine needle aspiration code. Therefore, you must report both the code for the aspiration, e.g., 10005, and the specific code for the CT guidance, e.g., 77012. Question 8. A patient has a screening mammogram of both breasts. The CPT code 77067 descriptor is screening mammography, bilateral, 2-view study of each breast, including computer-aided detection, CAD, when performed. Should modifier -50, bilateral procedure, be added to this code? A. Yes, because both breasts were imaged. B. Only if the payer requires it for all bilateral procedures. C. No, because the code descriptor specifies it is a bilateral procedure. D. Yes, but only if more than 2 views were taken of each breast. Answer: C. No, because the code descriptor specifies it is a bilateral procedure. The concept tested is identifying CPT codes that are inherently bilateral. The keyword in the code descriptor is bilateral, which means the code already includes the work of imaging both the right and left breasts. Appending modifier -50 to a code that is already defined as bilateral is redundant and incorrect. Always read CPT code descriptors carefully to see if terms like bilateral or unilateral are included, as this dictates the proper use of modifiers. Question 9. An MRI is performed on the cervical spine and the thoracic spine during the same patient encounter. How should these services be coded? A. With a single code for MRI of the entire spine. B. With 2 separate CPT codes, one for the cervical spine and one for the thoracic spine. C. With 1 code for the cervical spine and modifier -59 on the thoracic spine code. D. With the CPT code for the more extensive service only. Answer: B. With 2 separate CPT codes, one for the cervical spine and one for the thoracic spine. This question tests the principle of coding for each distinct anatomical area imaged. The CPT manual provides separate codes for MRI of the cervical spine, e.g., 72141, thoracic spine, e.g., 72146, and lumbar spine, e.g., 72148. Because these are considered 3 different regions, performing an MRI on 2 of them requires reporting 2 separate CPT codes to accurately reflect the services rendered. There is no single code for a spine MRI that combines these distinct areas. Question 10. A 55-year-old male with a known liver mass found on a previous ultrasound is scheduled for an abdominal CT to further characterize the lesion. What type of study is this? A. Screening study. B. Diagnostic study. C. Follow-up study. D. Limited study. Answer: B. Diagnostic study. This question is about differentiating between screening and diagnostic imaging. A screening is done on an asymptomatic patient to look for disease, while a diagnostic study is performed to evaluate a known sign, symptom, or abnormal finding. The keyword phrase, known liver mass, clearly indicates a pre-existing issue is being investigated, making this a diagnostic exam. The reason for the exam, the why, is the key to determining whether it is screening or diagnostic. Question 11. A physician's office provides the low osmolar contrast material used for a CT scan performed in the office. How is the supply of this contrast material reported? A. It is included in the CPT code for the CT scan. B. With modifier -25 on the CT scan CPT code. C. With a specific HCPCS Level II code for the contrast material. D. It is not separately reportable in an office setting. Answer: C. With a specific HCPCS Level II code for the contrast material. This question tests the billing for supplies, specifically contrast media, in a non-facility setting. While the CPT code for its CT with contrast covers the administration and imaging, it does not cover the cost of the contrast agent itself when provided by the physician's office. A separate HCPCS Level IIA code, e.g., A95XX range, must be used to bill for the supply of the substance. Remember, CPT codes cover procedures, while HCPCS Level II codes are often used for supplies, drugs, and durable medical equipment. Question 12. A radiologist is supervising a nuclear medicine procedure in a hospital outpatient department. The radiologist must be present in the office suite and immediately available to provide assistance, but does not need to be in the room for the entire procedure. What level of physician supervision is this? A. General supervision. B. Personal supervision. C. Direct supervision. D. Indirect supervision. Answer: C. Direct supervision. The concept tested is the different levels of physician supervision defined by CMS, Centers for Medicare and Medicaid Services. The keywords present in the office suite and immediately available are the exact definition of direct supervision. This is different from personal supervision, which requires the physician to be in the room, and general supervision, where the physician must be available but can be off-site. For many diagnostic tests in a non-hospital setting, direct supervision is the required level. Question 13. A patient has an X-ray of the right ankle, CPT 73610, and an X-ray of the right foot, CPT 73630, in the same session. Payer edits bundle these two codes. Which modifier should be appended to the second code to indicate it was a separate and medically necessary procedure? A. -50, bilateral procedure. B. -26, professional component. C. -76, repeat procedure by same physician. D. -59, distinct procedural service. Answer: D. -59, distinct procedural service. This question tests the appropriate use of modifier -59 to bypass a National Correct Coding Initiative (NCCI) edit. Although the foot and ankle are adjacent, they are distinct anatomical sites, and imaging both can be medically necessary. When payer systems automatically bundle these codes, modifier -59 is appended to the second CPT code, the column 2 code, to signify that it represents a different site and is a distinct procedure from the first. Think of modifier -59 as telling the payer, this service was not a duplicate, it was a separate procedure performed at a different anatomical site. Question 14. A radiologist provides fluoroscopic guidance during a lumbar puncture performed by another physician. The radiologist's service consists only of operating the fluoroscopy machine and guiding the needle placement. What should the radiologist report? A. The CPT code for the lumbar puncture. B. The CPT code for the fluoroscopic guidance only. C. Both the lumbar puncture and fluoroscopy codes with modifier -52. D. A consultation code. Answer: B. The CPT code for the fluoroscopic guidance only. This scenario tests your ability to code only for the service provided by your physician. The radiologist performed the imaging guidance, while the other physician performed the primary procedure, the lumbar puncture. Therefore, the radiologist should only bill for their part of the work, which is the fluoroscopic guidance, e.g., 77003. It would be fraudulent for the radiologist to bill for the lumbar puncture, as they did not perform it. Question 15. A radiologist owns the imaging center, employs the staff, and personally provides the official interpretation for an MRI study. This is known as A. Component service. B. Professional service. C. Technical service. D. Global service. Answer: D. Global service. This question defines the concept of a global service in radiology. A global service includes both the technical component, the equipment, supplies, and technologist, represented by modifier TC, and the professional component, the physician's interpretation, represented by modifier -26. When the same entity provides both parts, they bill the CPT code without any modifiers, as the code itself represents the total, or global, service. Question 16. A study is ordered to specifically visualize the arterial and venous structures of the neck using magnetic resonance technology. What is this procedure called? A. MRI neck. B. MRA neck. C. CT neck. D. CTA neck. Answer B. MRA neck. The key concept here is differentiating between a standard MRI, magnetic resonance imaging, and an MRA, magnetic resonance angiography. The keywords visualize the arterial and venous structures point directly to an angiography, which is a study of blood vessels. While an MRI shows soft tissues and organs, an MRA is specifically sequenced to highlight blood flow and vessel anatomy. Question 17. A patient with a family history of colon cancer undergoes a CT colonography. This procedure is also known as A. Barium enema. B. Virtual colonoscopy. C. Sigmoidoscopy. D. Conventional colonoscopy. Answer B. Virtual colonoscopy. This question tests your knowledge of alternative terminology for radiology procedures. A CT colonography, coded with 74,261 to 74,263, uses a CT scanner and computer software to create a three-dimensional image of the colon. This non-invasive procedure is commonly referred to as a virtual colonoscopy. Knowing this synonym is helpful for interpreting clinical documentation and selecting the correct code. Question 18. In radiation oncology, what is the purpose of a simulation procedure, CPT code 77280 to 77290? A. To deliver the first dose of radiation therapy. B. To map the treatment field and verify the positioning for radiation delivery. C. To create the radioactive isotopes used in treatment. D. To perform a follow-up scan to check for tumor shrinkage. Answer B. To map the treatment field and verify the positioning for radiation delivery. This question assesses understanding of the different phases of radiation oncology. Simulation is a critical planning service that occurs before treatment begins. Its purpose, as described by the keywords map the treatment field and verify positioning, is to precisely define the area for radiation targeting to maximize effects on the tumor while sparing healthy tissue. Simulation is coded separately from the codes for radiation treatment delivery and clinical treatment planning. Question 19. A pregnant patient in her third trimester receives an ultrasound to check the fetal heart rate and the position of the fetus. Which type of obstetrical ultrasound should be coded? A. A complete fetal and maternal evaluation, e.g., 76805. B. A detailed fetal anatomic examination, e.g., 76811. C. A follow-up or limited evaluation, e.g., 76816. D. A transvaginal ultrasound, e.g., 76817. Answer C. A follow-up or limited evaluation, e.g., 76816. This question tests the ability to differentiate obstetrical ultrasounds based on their purpose and scope. A comprehensive or detailed exam evaluates full fetal anatomy, which is not what was described. The documentation keywords check the fetal heart rate and position indicate a focused, limited assessment of specific elements rather than a full anatomical survey. This type of service is best described by a limited or follow-up OB ultrasound code. Question 20. CPT code plus 31627 is described as bronchoscopy, with transbronchial lung biopsies, single lobe. List separately in addition to code for primary procedure. The plus symbol in front of the code indicates it is A, N. A. Unlisted procedure code. B. Add-on code. C. Modifier -51 exempt code. D. New technology code. Answer: B. Add-on code. This is a fundamental CPT concept question identified by the plus symbol. A code preceded by a plus sign is designated as an add-on code, which describes a service that is always performed in addition to a primary procedure. Add-on codes are never reported by themselves and are exempt from modifier -51. Recognizing the plus symbol is a quick way to know that the code must be billed with an appropriate parent code. Question 21. A patient with abdominal pain undergoes a limited ultrasound focused only on the right kidney and the appendix. How should this be coded? A. Code for a complete abdominal ultrasound, 76,700. B. Code for a limited abdominal ultrasound, 76705, and a limited retroperitoneal ultrasound, 76775. C. Code for a limited retroperitoneal ultrasound, 76775, and a limited abdominal ultrasound, 76705. D. Code for a limited abdominal ultrasound, 76705. Answer: D. Code for a limited abdominal ultrasound, 76,705. This question tests the correct application of limited ultrasound codes based on anatomy. The appendix is an abdominal organ, while the kidney is a retroperitoneal organ. However, CPT guidance often directs coders to use the limited abdominal ultrasound code, 76705, for an appendiceal study. The CPT Assistant, a coding resource, clarifies that a focused exam of the appendix is reported with 76,705, and since a limited exam can include one or more organs, this single code can encompass the view of the kidney as well in this specific clinical scenario. It is crucial to check specific coding guidance for commonly performed limited studies. Question 22. What does a DEXA scan, CPT code 77080 to 77081, measure? A. Blood flow in the extremities. B. Electrical activity in the brain. C. Bone mineral density. D. Soft tissue organ size. Answer: C. Bone mineral density. This question is a test of medical terminology and procedure knowledge. DEXA, which stands for Dual Energy X-ray Absorptiometry, is a specific type of imaging test used to measure bone loss. The key concept is knowing what the procedure is for. It is the gold standard for diagnosing osteoporosis by assessing bone mineral density. This is a common procedure, and knowing its purpose is essential for correct code assignment and linking to an appropriate diagnosis. Question 23. A study performed to evaluate the arteries of the chest using a CT scanner and intravenous contrast is best described as A. CT chest with contrast. B. CTA chest. C. MRA chest. D. PET scan of the chest. Answer: B. CTA chest. The concept tested is the difference between a standard CT and a CT angiography, CTA. The keyword arteries is the critical clue that the study is focused on the vascular structures, not just the general tissues of the chest. A CTA, e.g., 71,275 for pulmonary arteries, is specifically timed and processed to optimize visualization of blood vessels. A standard CT with contrast, e.g., 71260, provides a more general view of the organs and soft tissues. Question 24. A radiologist provides a formal, written second opinion on an MRI of the knee that was performed and interpreted at another facility last week. The patient's physician requested the review. How should the radiologist's service be coded? A. With CPT code 73721-26. B. With an E/M consultation code. C. With CPT code 76140, consultation on X-ray examination made elsewhere, written report. D. This service is not billable. Answer, C. With CPT code 76140, consultation on X-ray examination made elsewhere, written report. This question tests the specific coding for an outside image review. The keyword phrase, second opinion on an MRI, made elsewhere points directly to CPT code 76140. This code is used specifically when a physician provides a formal written interpretation of an imaging study that was performed and initially interpreted at a different facility. It is incorrect to use the primary CPT code with a -26 modifier, as that implies the physician performed the initial, primary interpretation for that procedure. Question 25. An X-ray of the femur is ordered. Anatomically, where is the femur located? A. In the forearm, between the elbow and wrist. B. In the lower leg, between the knee and ankle. C. In the upper arm, between the shoulder and elbow. D. In the upper leg, between the hip and the knee. Answer, D. In the upper leg, between the hip and the knee. This question tests fundamental anatomical knowledge, which is a prerequisite for accurate radiology coding. The femur is the large bone in the thigh, or upper leg. Correctly identifying body parts is the first step in locating the right CPT code. For example, knowing the femur is in the upper leg helps you find the correct code, 73551 to 73552, and not confuse it with codes for the tibia/fibula, lower leg, or humerus, upper arm. A solid grasp of anatomy prevents simple but significant coding errors.